what would be some ways of a person working a frontline type of a job going for assistance? Like, what would that look like in terms of disclosure? Like, I'm unable to share where I work, but I am seeking help. Is that kind of what we're hearing?
That's that is exactly what you're hearing. And
Okay.
once the relationship becomes one of trust, you can shift to hypotheticals, and I say that,
Gotcha.
but you can always say that. Well, let's say, and then they can make up a job because they're, anyone's not going to tell you what they're actually working on or what they're doing, for the fear of the therapist is going to probably put me that. As far as building trust, I think what I've experienced is that just being respectful of the person, just to ask them where they want to sit. That may sound simple, but you're not going to have your back to the door. I mean, as the client,
Yeah.
or respecting when it gets real quiet, because when the quiet time is actually a very insightful time for you as a therapist, because they're either processing, rewording it in their head, or there's something going on there.
Yeah.
And sometimes, we don't feel comfortable in quiet, but as the client themselves realize they can trust you, and they may not use insurance. I know veterans that will not use TRICARE probably in the recent 6 months because they're fearful that somebody will go in there and find out. So they have to find places that they can afford and also pay to get the service. So the probing questions, while you may want to know, as again to help them, they will help find a way to communicate with you, and that's just being accepting of it. I know that sounds so broad and don't mean to condescending, but sometimes if they talk about, well, let's say you lived on a farm, and you're kind of going, where are we going with this? But you understand that that's just what they could grab onto right then.